everyone, my name is Rocio and I will be speaking today about the opioid epidemic here in the United States. Do you know of anyone that has passed away from an opioid overdose? Does any of your loved ones suffer or has suffered from an opiate addiction? According to CNN Health, more than 130 people die every day in the United States from an opioid overdose. Anyone can be prescribed with opioids at any time. It is highly addictive and dangerous. Despite this, more physicians are prescribing it. Effects of opioids in the brain and why it is so effective and needed for medical purposes, data of the negative impact of opioids in our society, and how to be proactive and fight a possibly deadly addiction will be discussed further. Let's now explain the effects of opioids in the brain and why it is so efficient in pain management. According to Maryland Addiction Recovery, painkillers work by blocking the brain's perception of pain by binding to opioid receptors, interfering with the signals transmitted by the central nervous system to the brain. Narcotics have a depressant effect on the central nervous system and decrease the feeling of pain while increasing a feeling of relaxation. When painkillers are used for a long period of time, the body slows down the production of natural chemicals that the body releases naturally to relieve pain, and it makes the body less effective in relieving pain on its own. Opiates are definitely one of the most effective ways to get rid of physical pain. On the other hand, there's a severe death and addiction toll related to it. Opiates are definitely the most efficient way to get rid of physical pain, but on the other hand, according to Nature Journal, most European countries have been insulated from this opioid epidemic. Doctors in Europe are not motivated financially to make prescriptions, whereas the US medical community embraces the idea that people have a low risk of developing addiction. European studies have proven the complete opposite of this theory. More people in the United States died from overdoses involving opiates in 2018 than from HIV or AIDS-related illnesses at the peak of AIDS-related epidemic. According to the CDC, clinicians should consider opiates only if the benefits outweigh the risk. When used, opiates should be combined with a non-pharmacologic therapy and non-opioid pharmacologic therapy. Discuss the risks and benefits before starting and during therapy with your patient, and use the lowest effective dose, and if needed, increase it, but only for a short period of time if there's a really acute pain. Although opiates are very effective in pain management, perhaps have not been overwatched, and the consequences are devastating. There's not a lot of support treatment that has taken place to regulate its harms into our bodies and the addiction related from it. In conclusion, opioids are very effective in pain management, but it has disadvantages that take many lives every day in the United States. Are physicians overprescribing opioids? Or have physicians been lacking on a therapeutical follow-up on these patients prescribed with painkillers? Are painkillers more useful or harmful? I am an EMT and have had to personally pick up patients with overdoses. Some of them were young patients. Others were older ones with disease, such as dementia. Patients with dementia most likely have forgotten how many painkillers took before and ended with an unexpected overdose.